Recorded Medication Teaching, an initiative of the Manitoba ACS Network and St. Boniface Hospital. ACE inhibitors. Angiotensin-converting enzyme inhibitors, also known as ACE inhibitors, are a type of blood pressure medication that relax your blood vessels. This lowers your blood pressure, protects the heart muscle by making it easier for the heart to pump blood, and can help your heart muscle recover after a heart attack. After a heart attack in people with diabetes and in those with high blood pressure, ACE inhibitors have been shown to prevent heart attacks, stroke, and death. ACE inhibitors also protect the kidneys, especially in people with diabetes, kidney disease, or high blood pressure. Examples of ACE inhibitors include ramipril, perindopril, lisinopril, fosinapril, enalapril, trandolapril, quinapril, and captopril. As you've noticed, all of these drugs end in pril. ACE inhibitors should be taken at the same time every day as directed. If you take your ACE inhibitor more than once a day, try to space the doses evenly throughout the day. ACE inhibitors can be taken with or without food, except captopril, which should be taken 1 hour before meals. If you miss a dose of your ACE inhibitor, take it as soon as you remember, unless it is almost time for your next dose. Do not take an extra dose to make up for the missed dose. It's important that you continue to take your ACE inhibitor even if you feel well, since the protective effects of ACE inhibitors are not something you would normally feel. If an ACE inhibitor or other medication lowers your blood pressure too much, you may feel dizzy or lightheaded. This may increase your risk of fainting and having a fall. If you get dizzy or feel faint, sit or lie down right away to lower your risk of falling. If you find you sometimes feel dizzy or lightheaded, make sure you walk slowly up and down stairs and change body position slowly, especially when standing up or getting out of bed. You may want to first dangle your legs over the side of the bed before standing up. If you have a blood pressure machine, check your blood pressure when you feel dizzy and make a note of it. Let your nurse or doctor know if you take an ACE inhibitor or other blood pressure lowering medication and feel faint or dizzy. Often, the problem can be solved by adjusting your dose. About 1 in 10 people who take an ACE inhibitor may notice a dry cough or tickle in the throat that doesn't go away. If this happens, let your nurse or doctor know. This can be solved by switching to another type of medication that does not cause a cough. Don't stop taking your ACE inhibitor without talking to your healthcare provider first. ACE inhibitors may increase the amount of potassium in your body. Signs of too much potassium include nervousness, confusion, an irregular heart rate or pulse, numbness or tingling of the hands or feet, and weak or heavy legs. If you think you are having these problems, let your healthcare provider know, and he or she can check your potassium level. Avoid using salt substitutes that contain potassium or taking potassium supplements unless prescribed by your healthcare provider. You should not take an ACE inhibitor if you are pregnant or planning on becoming pregnant. Very rarely, ACE inhibitors can cause serious swelling, especially of the face, mouth, or throat. This can be dangerous, and you should call your local emergency number for advice if this happens. Some over-the-counter medications may interact with ACE inhibitors. If you take an ACE inhibitor, it may be best to avoid some cough, cold, and allergy products, especially products with decongestants such as phenylephrine or pseudoephedrine. If you need to take something for pain, it's usually best to avoid ibuprofen, also known as Advil or Motrin, naproxen, also known as Aleve, and higher doses of ASA or aspirin, as they can raise your blood pressure and harm your kidneys. Acetaminophen, also known as Tylenol, is a safer option for pain as it will not affect your blood pressure or kidneys. It's usually best to talk to your pharmacist or other healthcare provider when choosing over-the-counter medications so they can help you choose the medications that are best for you. If you become ill with symptoms of nausea, vomiting, and/or diarrhea, this may lead to dehydration. If you take an ACE inhibitor and become dehydrated, this can harm your kidneys. You may need to stop taking your ACE inhibitor during your illness if you are not able to drink enough fluids. Talk to your healthcare provider if you feel you are not keeping up with your fluids during your illness. ACE inhibitors have valuable heart protective effects and play an important part in the treatment and prevention of heart attacks. By taking an ACE inhibitor, along with other heart protective medications, you can reduce the risk of future heart attacks and keep your heart as healthy as possible.